Hi, this is Autumn, Mara, Rachel, and Allysa, and today we're going to talk about your first job. We want you to have the right fit. We need you to work on your time management. So this presentation is about finding your place in your first job as an RN. We're talking about this because it's a really big decision. Your first job is where you're going to start out, where you're going to learn everything for the basis of your future career. We want you to get the right place whenever you go out into the field. We don't want you to be somewhere that you're unhappy, because nurses that are in happy jobs or satisfying jobs don't stay for very long. And patient outcomes are better whenever nurses are happy. We also want to educate you on different options that are available, because there's so many that you wouldn't even think of. And we want to encourage growth during your time as a new graduate nurse, like with the time management thing. We want you to be able to manage patients and do more than we've just learned in SimLab. So some considerations whenever you're job searching: you want to look for openings. You can check Indeed, hospital websites if there's a hospital that's closer to you. There's recruiters out there that are dying to talk to you, and even your peers. I mean, a lot of them will have a family member who works in some kind of odd job or something like that, but it's really good to look around and see what's out there, because there's a lot more than you would think of. If you have a special interest like neuro or cardiac, there's a lot of specialty floors for that. So you want to make sure that your job's going to line up with your interests so that you can be really involved in your career and not just show up to work every day really bummed out. So there's orthopedics, geriatrics, neuro, cardiac, labor and delivery, NICU. There's school nursing positions. There's so many jobs out there with different environments to be in. You also want to consider workplace culture. You want to make sure the employees have a high job satisfaction and morale, because you could be in a job that's just like amazing and super easy, but if you're just surrounded by negativity all day, that's going to be really hard to show up every day and do your best. Maury tells us to walk around in regular clothes on a Saturday and see how people are acting. Do the nurses look happy? Do the patients need to be taken care of? Is there 50 call lights going off and everybody's sitting at the nurse station? You also want to consider your lifestyle whenever you're looking for a job. So how will working in this specific hospital or facility affect you? Is the drive to and from work going to make you insane every day? And is the pay enough for you to make ends meet? And what are the benefits like? You don't want to put yourself in a bad situation where you're not going to be able to do what you need to do and make ends meet, or spend all of your time in the car. I mean, a 12-hour shift is a lot whenever you've got a 2-hour commute both ways added on there. I mean, that's a lot of your life you're spending dedicated to that job. And then you also want to look at your education aspects of it too. Does the hospital require you to have your BSN, and will they help you pay for it? Do they have other certifications available, like emergency nursing and stuff like that? There's a lot of different settings that you wouldn't think of other than a hospital. Some of them that we have are a nursing home or extended care, long-term care facility, nursing education, community and public health setting, student health services, ambulatory care setting, insurance claims and benefits, planning or licensing agency, or prison or jail. There's also school nursing. There's so many options out there, and it's really just good to look on Indeed to see what's going on out in the field and where the availabilities are. So the reason this is really important, and we're going over it in class, is that our nursing faculty really wants to see us succeed, and they want us to be prepared for our job searches and for entering the field. And our new nurse managers also want us to stay whenever they hire us, because it costs a lot of money to train a new grad nurse. I don't remember the exact number, but it's like a whole lot, like 1 year's salary. So whenever you get hired, you obviously should try to stay there for as long as possible if you're happy. So try to be happy whenever you get your job. Our patients also need adequate staffing for adequate care. So you want to make sure that it's somewhere that you're able to show up every day and really give your all. Because if you're not really all there and you miss something on an assessment or something, that could be really bad for a patient. You just want to put your best foot forward, and finding a job that you're emotionally available for is really important. And our classmates also want to see us reach our full potential. Like, I know that my group just wants to see all of our classmates succeed. It's not a competition or anything out there. Like, we all need to be the best nurses that we can possibly be, especially with such high tensions right now out in the world. And our patients are better cared for from people who genuinely enjoy their jobs. That's just important. We need to be able to show up and be nice to our patients. They're not having a good day. We need to be able to give them the best care possible because we're the ones standing there with them all day. So it's just really important that you find the right job for you.
Your role as a new RN is to evaluate yourself. You need to determine your interest and your knowledge base to make sure that the job that you plan on taking is going to be the right fit for you. In your job search, do the research on different jobs available before you determine the best fit. Look at incentives and education, and if you plan on furthering your education, if that hospital will help you with that, and what education you're going to need to fulfill this job that you plan to achieve. Make sure that you're educated for the job that you're planning on taking, or that you're willing to get the education that job requires. Go that extra mile. Learn and perfect time management so that you can deliver safe and efficient care to your patients. Master these basic skills. Know what you don't know. Those know-it-all RNs that step to the floor are the most dangerous ones there because they think they have it all under control without anybody else's help. Newsflash, it's a healthcare team for a reason. So you need to be open-minded. You can learn something from everybody on that floor. And thinking that you have the answers to everything isn't going to do anything but make you not have friends. Learn to think outside the box, because when you learn the little steps along the way, you get creative, and then you can start solving your own solutions, and you'll be a more nursier nurse than somebody else one day, or at least hopefully you will. Everybody knows that nurses are always in demand. You can always find a job, and there's multiple different kinds of nursing jobs out there. I don't have to, list all of them off because a lot of people know what area they want to go into, but a few of them that I did find were on this slide, which are OR nurse, travel nursing, nurse practitioner if you want to keep going to school, med-surg nurse, which is what we're all going to grow up to be here in about a month or two, ICU nurse, ER, labor and delivery, psychiatric, pediatric. These are just some of the doors that we have available. Skills nurses need to master. Time management is probably one of the biggest ones that you need to be good at. It's a basic skill needed. Nurses pretty much stay busy, and it's hard to accomplish everything that's expected of us. And some days it's dang near impossible to accomplish everything expected and deliver good care to your patients. So learning what to do and when and in the best time frame can help a lot. A couple tips that I found were to plan your day in advance, identify and schedule times for the most important activities first, like dressing changes or med passes or certain assessments that need to be done first, like if you've got somebody with a chest tube. Delegate what you can, when you can. Don't be afraid to ask your CNA, hey, can you get this for me? If it's within their scope of practice. But on the same side, don't run them to death because you want to be lazy. You're not going to make any friends. Organize yourself. Cheat sheets are a must. I like to call these the C's: compassion, communicating effectively, and critical thinking so that you can be safe and knowledgeable. Compassion's like one of the main things nurses are expected to be. We're patient advocates. We're there to care for these people in their weakest moments. And that is what we're called to do. That's why we're all here, is to take care of people. And these people are broken. So compassion is the main thing that we need. Communicating effectively is going to help us not only with our patients, but other staff, our CNAs, our respiratory, our physicians, the patient's family, and even the patient. We need to communicate well with everyone around us so that everybody's safe and they're knowledgeable. Critical thinking, well, we've been learning that for 2 years, so apparently that's going to be kind of important, don't you think?
When looking at new graduate registered nurses in their first job, a study conducted in Nevada sent surveys out to 3,077 registered nurses that were licensed within the past 5 years. The results of the survey that found that 30% of the new grads left their first job within 1 year and 57% left by 2 years. Rapid turnover of new grads wastes orientation resources and does not alleviate the staffing shortage issue. When asked, patient care issues such as unsafe nurse-to-patient ratios were perceived as the most negative aspects and the most frequent reason for leaving. These findings have implications for hospital administrators to improve the work environment and retention rates of recent RN graduates. In another study conducted by the National Council of State Boards of Nursing, reported data suggested 17.5% of new grad nurses were leaving within 1 year in their first job, and 33.5% leave within 2 years. The numbers were further broken down by looking at nurses who completed a nurse residency, in which 16% left, versus nurses who have not, in which 27% left, showing nurses who did not have a nurse residency program left their first job at almost double the rate of those that did. This comes at a great expense to the hospitals that spend about $50,000 per new grad in recruitment, orientation, and their training.
Okay, plan of action. Exploring hospitals that offer a nurse residency program may be a good place to start as a new grad RN. Hospitals put a lot of money into hiring employees, especially with a residency program, in hopes to train you to their standards and retain you as a happy, hard-working employee. If you are interested in a particular specialty right out of nursing school, such as pediatrics, mental health, or others, it is beneficial to research the requirements needed in order to get there. Do you need to have at least 1 year of RN experience before applying to that specialty floor? Do you need recommendations from instructors and preceptors? Additionally, many specialty areas will require further certification and education beyond your hard-earned registered nurse degree. Again, as mentioned earlier, it is important to see if your employer will reimburse tuition costs for higher education or needed certifications for your job. Desired outcome is, of course, finding a job that you love and gain essential skills to deliver the best care that you can give in your job. To continue, as students who are about to graduate nursing school, obviously our main goal is to pass the NCLEX. We have worked way too hard and put in far too many hours. We deserve to put RN behind our name. Throughout the course of this program, our professors and clinical staff have worked tirelessly to provide us with the most up-to-date knowledge in nursing practice and the foundational information we need to understand in order to critically think like a nurse. Physical and emotional health are a top priority in nursing school and healthcare overall. This is tough. The content is not easy, no patient matches the textbook description, and the staffing ratios aren't what NCLEX would like us to believe. We are finishing nursing school in unprecedented times right now. COVID-19 has not had any biases on who or what it affects. For us, it means we don't get to see each other in person anymore, we don't get to finish clinicals at the bedside, and we don't get a pinning and graduation ceremony in May commemorating all of the hard work and effort we put into this. But for us, this also means that we are finishing nursing school during a global pandemic. It means not only that we are new nurses with fresh knowledge and skills, but that we are adaptable to change. We are resilient. We are the eyes and ears of the world going into this field. Watching the medical community from the outside and jumping into the middle is an incredible gift we all have. We have the power to change healthcare, to change infection control and disaster preparedness, to educate the public who rely so heavily on the medical community to advise them on what to do next and where to go from here. Yes, even if that means teaching someone how to wash their hands. Finding your place in your first job as a registered nurse is a scary concept, but you are well prepared. Remember to research your choices, learn to prioritize, keep track of tasks and to be done and to do, and never be afraid to ask for help.